Okay, I think we are set. Can you, Howard, can you see my mouse moving around? Okay, cool. All right, why don't Howard and John turn your videos off so we don't see you. John, click on the video camera and then it'll black you out so you're not being recorded. Okay, so we're here today to talk about shoulder pain. My name is Denise Schwartz. I am a physical therapist and I own the Manual Touch Physical Therapy in Wheeling. I'm at the corner of Milwaukee and Dundee, so I'm literally practically Northbrook. And today we're going to talk about what you can do for your shoulder pain without resorting to surgery or shots or drugs, although there is a place for all those things. I started my career many, many years ago working at Lutheran General Hospital. While working there, I worked in the hospital. I saw patients inpatient. I did rehab. And then really within a couple of years was just doing outpatient therapy, which is what I'm currently doing now. When I got out of school, I knew that back pain was the #1 reason people went to see their doctor. So I went to many classes on how to take care of back pain, and I became really good at it. I like to call that traditional physical therapy. Along the way, I took other classes to take care of shoulders and knees and hips and feet and all, et cetera, et cetera. And then maybe about 10 plus years into my career, I started studying some non-traditional therapy. And what does that mean? Non-traditional therapy is a hands-on type of therapy where we look at the whole body and what is limiting you from healing. And it's a very, what we call an indirect technique. So a direct technique is, the best example of that is if somebody does like a chiropractic manipulation where they really force something to move is a direct technique. But a non-traditional or indirect technique is working with your body. So I'm not forcing it to do something it doesn't want to do. What I found after studying this work for a couple of years, I had shifted my method of treating people to more this non-traditional approach, and I really could help everyone. Whereas before, there was a population of people that just didn't respond to traditional therapy. And now I found with some of these non-traditional techniques, I could help those people who were very sensitive, chronic pain, chronic illness, people who got flared up really easily. And so I left the hospital to work for the company for this work called Center IMT. And I was with them for about 7 years. And we had an office in Elmhurst and here in Wheeling. And 11 years ago, we parted ways and I took over the office. And I became the Manual Touch Physical Therapy. And what I do is I combine traditional and non-traditional therapy to get people back doing the things they love to do. I use a lot of functional exercise. What I decided is a lot of those traditional techniques that I wasn't using anymore was still very valuable. So I brought that back in and I coupled the two together. Okay, so we are here to talk about shoulder pain. Now, if we were in person, I would have asked everybody in the audience, when does your shoulder hurt? What do you have difficulty with? But I do find these webinars are just challenging to be interactive. So these are the common complaints people come in with. I can't lay on my shoulder, so it hurts when I sleep. I can't lift overhead. I have difficulty getting dressed, washed, shaving, doing my hair. Opening or closing a door, pulling up like a blanket, to pull up a blanket is challenging, making the bed, putting a hand in your back pocket. Women can't reach their bra behind their back. Anything overhead is a problem, and we talked about reaching behind your back. So those are common things that people have. Most of the time, people that I see have complaint when they're using their arm. It doesn't usually hurt when they're just sitting still. But that also is a common complaint. It kind of just aches all the time. So we have to discern what's going on when that's the case. This is an ebook that I have available on my website. If you put your email and your name in the chat box, I will send you a link to download this ebook. And this gives you tips on how to take care of yourself throughout the day. So the most common cause, what we're going to talk about today is the 3 most common causes of shoulder pain. Then we're going to talk about what are the signs and symptoms of each of those issues, and what can we do about them, okay? The first one that's most common is an impingement of the rotator cuff or bicep tendons. Number 2 would be a frozen shoulder, or medically known as adhesive capsulitis. And then, of course, arthritis. You know, what I didn't put down here is people do fracture their arm, and so that's another cause of pain as well. So the first thing that's the easiest way to discuss shoulder pain is to have an understanding of the anatomy. So this is, if you're looking at someone from the front, and we stripped away all your soft tissue, these are your bones of your shoulder. This all makes up the shoulder girdle, okay? So what's missing here is your rib cage that sits right in front of, this is your scapula, or a lot of people call it your backbone, or shoulder blade. I think people call it shoulder blades. This is your humerus, your upper arm bone. This is your clavicle, or commonly known as your commonly known as your collarbone. And then this is a joint called your AC joint. This is the acromion. So this scapula comes right here and connects to the humerus. And this is known as your glenohumeral joint. And this is the actual shoulder joint itself. It's a ball and socket. So it sort of sits in there like that. And it's a very unstable joint because it can move in all directions. Okay. This is also part of the shoulder girdle, if you will. This bone is a part of the scapula, and it connects to the clavicle right here. And it really doesn't have much movement, but if somebody falls on their shoulder, like off of a bicycle, this can become separated. You could fracture the clavicle here. This ligament can become strained, so that can be a problem. This is from looking at the back side. So if I'm looking at your back, this is your rib cage. Here is that scapula or shoulder blade. Here is the humerus. This is a component of the scapula that's called the spine of the scapula, which connects to the acromion, and it comes to the front, connects to the clavicle. And then the muscles that make up around the shoulder girdle, the primary muscles are known as the rotator cuff. And that's 4 muscles that sit around. So here's your shoulder joint, and it sits around it kind of like that. There are 2 muscles in the back. You got your infraspinatus muscle. You have a teres minor, and they both attach to the humerus and the scapula. And then you have a third one up here called your supraspinatus that is up at the top part of the scapula and comes underneath to attach to the humerus. And that's the one that gets impinged most often. And then there's a 4th one called your subscapularis. And this sits between, between your rib cage, sits in front of the subscapularis. Then you have the subscapularis, and then you have your scapula. And that comes in here and also attaches to the humerus. It all attaches together. Running along in here are your biceps, bi meaning 2. So there are 2 heads of the bicep. You have the long head that comes in here, and then you have a short head that attaches here onto the humerus itself, whereas the long head will attach onto the scapula, I believe. Okay. What's very important to know when people raise their arm, this bone, the scapula, moves in a certain special rhythm with the humerus. Okay, so if you're looking at your back, so here is the inside of the scapula, the way you're looking at it. Okay, and you raise the arm up, the scapula should come up like so. And when your arm comes down, it comes like this. What often happens when someone has shoulder pain, an injury, rotator cuff tendonitis, frozen shoulder or something, this rhythm is off. So what might happen is as you go to move your arm, the humerus, this scapula might swing out too soon. It might elevate, you know, where people who are very weak in that rotator cuff might do something like this, where the shoulder kind of scrunches up into their ear. This is known as your scapulothoracic joint. And this is really, really key. So remember I told you that this joint here is a ball and socket and it's very unstable because it can move in all directions. The only way besides these muscles to, you know, stabilize and keep it within that joint is this the scapulothoracic area here. This needs to be stable in order for you to move your arm. So we do a lot of exercises to work on the stability here in order for you to be able to safely move your arm. Trying to think of, it's kind of like if you, trying to think of the floor of your house or basement. That has to be very solid and stable so everything else can stack up on top of it. If for some reason, you know, like that horrific building collapse in Florida, you know, that I think it was a pylon or something here had corroded. So the stability at the base was a problem. And so up above couldn't stabilize. And so it collapsed. So it's a really extreme example, but it's similar. So we're going to work on a lot of stability here. So this shoulder, the arm, can move the way it's supposed to without gliding up, so impinging that muscle in there, so you don't keep ripping it up and irritating it. So we talked about the most common, now that we talked about the anatomy, the most common issues are rotator cuff tendonitis, and impingement, which is this, oftentimes it's the supraspinatus muscle, which runs underneath the clavicle here. And if that scapulothoracic rhythm is off, then when you go to move that the shoulder, it might glide up, impinge that supraspinatus, then you get irritation, you get inflammation. Over time, you get wear and tear. You might rip it. It might rip. It might have micro tears in it. So that's why it's very important for us to learn for you to learn how to stabilize here. So this, you can move your shoulder freely without irritation. The other issue, the other impingement is this bicep tendon here. And that is like right here. If I rotate like that and I stick my finger in this little groove, I can feel the bicep tendon. And that can get very irritated. Oftentimes people have both. But this is a tricky one to diagnose and work with. I do find older folks sometimes rip the bicep tendon and they get kind of like a Popeye where it bulges out here and it's torn. I don't do a whole lot for that, but more often than not, it's just the tendon is inflamed and impinged in there and it just gets irritated every time you move the arm. So again, we have to work on exercises to decrease that impingement process and really re-educate your body how to move efficiently and effectively. The second most common issue is a frozen shoulder or adhesive capsulitis. And that's what happens right in here in the glenohumeral joint. Typically what happens, people have kind of pain in their shoulder. They don't quite know what it is. They may not be using the arm as well. And over time, They find they can't raise their arm over their head, they can't rotate, they can't reach behind their back because they have developed adhesions in the joint here. So that capsule over the joint, over in here, over the shoulder joint, thickens and develops adhesions in there, and you go to try to move and everything is stuck together, okay? What happens is initially, usually people have a severe amount of pain and it's throbbing and it hurts all the time, and it really hurts when they move it and they just can't raise it up very high. That's the freezing stage, and it's really very painful. And unfortunately, there isn't a whole lot we can do at this stage. You take some Tylenol or medication to kind of reduce that pain. But once you become in that freezing stage, it just has to go through its course of freezing. And then at some point, that really severe pain will settle down, but you're like, I just can't go any further. I can't move here. And it's just stuck. And it hurts maybe at the end range, but it's not that severe. That's that plateau stage. And that's where we want you to come into physical therapy to help break apart those adhesions and improve your mobility. And then you move into a thawing stage where you start to move. So we do know from studies that if you don't do physical therapy, you don't do anything, usually people get over their frozen shoulder, but it might take a very long time, a year or 2 years. But if you come in for therapy sooner than later, once it's past this really very painful stage, some people get better pretty quickly, like 6 weeks to 2 months. And then there's some people that it's just going to take 4 to 8 months to get better. Okay. Other things about a frozen shoulder is it usually happens after age 40. For some reason, it happens in women more than men. And then once you get a frozen shoulder on one side, you are more likely to get it on the other shoulder. Again, I'm not sure I've ever read reasons why. We just know that happens. Okay. The third most common cause is arthritis. And arthritis, as we know, is a degeneration of the bone in the joint, a degeneration of cartilage inside the joint. So that nice shoulder ball and socket where you have some space in there gets smaller because the wearing away inside of the joint makes it rub against each other. And it's very painful. And what I find with that is with physical therapy, we can't be aggressive. It's got to be gentle. And you just want to stay as mobile as you possibly can. We just need to find the key mobility exercises that you can tolerate without flaring it up. It's a tricky thing. Sometimes the way they treat it, if it gets bad enough and people are in pain long enough. I had a woman a couple of years ago. She was making nice progress, but then she fell and irritated again. And we made a little bit of progress, and then I think she fell one more time. And it just was so bad, we just couldn't help her. And she wound up getting the shoulder joint replaced. So sometimes we perform miracles here in physical therapy, and sometimes we don't. So there is a place for surgery. There's a place for getting steroid shots to bring down the inflammation. But essentially, physical therapy is designed to teach you to help promote healing and to teach you how to function optimally so you don't keep irritating the area. All right, so here is a couple of people who talked, the patients that I've seen who talked about how well they did. This woman was a pediatric physical therapist. Those of you who may, pediatric physical therapists work with children with pretty severe disabilities, and it's a pretty physical job. And so my friends who are all about my age now, we're in our late 50s, all are getting injured. It's very hard to keep up that kind of work later in life. So I've treated quite a few pediatric physical therapists. And this woman talked about how her left shoulder and neck were getting progressively worse. And she came in and we worked on some manual therapy and some exercises, working on her posture and function. And now she's doing very well. and can sleep through the night and can do her yoga. Okay, we talked about that. Here's a man who talked about his frozen shoulder. And he was one of the lucky ones where within a couple of months, he was able to put on his shirt and his jacket and really didn't have any more pain, and had about 80–90% of his motion back. So he did really well. This woman, she had a frozen shoulder. She saw another therapist and doctors. It was about 80% better, but something still was bothersome. And she came to my talk about a year later, and I talked about the bicep tendon. We talked about that earlier, how you can have an impingement there. What I didn't say is that sometimes I get people in here and they tell me it's their shoulder, and the doctors tell them it's their shoulder, but it's really just their biceps tendon. And there are some different, there's quite a few similar exercises. There are some that will irritate the bicep more. So we have to back off a little bit. And that's what happened with this woman. It was really her biceps tendon that was still irritated. And so I discovered that, we worked on it, and she got better, and she now can put on her shirt and without a problem. And so funny, I remember actually running into her at a restaurant, and she raised her arm up. See, look, I can move my arm. So she did really well. All right, so what else could be causing shoulder pain? And this is something that's very important for us to discern when you come into therapy or when you see your doctor. It could be coming from your neck. So if you're having pain, numbness, or tingling in your arm, especially numbness or tingling, it's probably coming from your neck. So we need to look at that as well. Here is a tip sheet that I made on things you can do to help you through with your shoulder pain. A lot of times, the biggest reason you're coming in here is for us to teach you how to function with your pain until the pain is resolved. And those tips that we give you while you're in pain is what you want to do when you're not having pain. So here is a link right here that you can get. If you copy this link, or if you put your name in the chat box with your email, I will send you this link on to get this tip sheet. It's also on my website that you can get as well. All right, so how do we know if physical therapy can help? Well, when you first come in to therapy, I'm proud to announce in Illinois, you do not need a prescription to come in to see me anymore. However, if you are using Medicare, we do need a prescription from your doctor. Otherwise, people who are not on Medicare, you can come in and see me without a problem. Anyway, so the first thing we do, we talk and we ask you some questions. You know, what causes you pain? When does it hurt you? And then when we do our evaluation, we want to see if we can reproduce the pain. So in other words, have you move your arm, I'll assess your strength, your mobility, and we'll discover where it might reproduce your pain. And then we could probably help you. That's reducible. Some cases, if people are in pain all the time, or if I do go through these special tests and movements and nothing really specific causes the pain, then it's not likely that we're going to be able to help. It's very challenging. I give an example. It wasn't of shoulder pain, but of back pain. About 4 years ago, all of a sudden I don't typically have back pain. I'm really fortunate. I've never had an injury working. But I went out for my morning run and I had some pain, low back pain on the left side. Thought that was odd. It didn't make it worse for me to run, so I continued. And then the next day it started radiating around to the front of my hip. And by the third day, it was hurting me a lot. And by that evening, I couldn't sleep. I couldn't find a comfortable position. So I knew that it wasn't reproducible. So it was something else causing my pain. So I went to the emergency room because it was in my low back. They worked me up for a kidney stone. And, I went in, I said, it's not reproducible. I know it's not musculoskeletal. So they worked me up for kidney issue. 2:30 in the morning. We don't know what it is. It's got to be muscular. And by then I wasn't going to argue. So, I lived on Vicodin for a few days, and 7 days after I had the pain, I scratched my back and there was a rash. So I had shingles. So you can have shingles without a rash, and it's really hard to diagnose. And the doctors aren't looking for that. So bring it up if you have weird pain. Number two, it wasn't reproducible. So typically physical therapy would not help. What I will tell you that will help those kinds of pain is some acupuncture. And some of the non-traditional therapy I do is helpful as well. But essentially, traditional physical therapy isn't going to help shingles or some sort of nerve pain that we can't reproduce. Okay, so what is the biggest mistake people make with shoulder pain? They ignore it. So it's really important to take care of your pain sooner than later. Get to your doctor, give me a call. As a thank you for coming to this webinar, I'm offering a free telephone call or telehealth appointment. We can discuss your issues and what I think we could do for you or give you my recommendations. When you come into therapy, what will we do? Well, we'll do some hands-on therapy, which we call manual therapy. That's working on the tissues that might be irritated, finding where there might be a limitation in the system, in your body, anywhere. So for example, I've had women who've had breast surgery and they have a lot of scar tissue underneath. So I may work on the scar tissue there, and that may be limiting their mobility. Even men who have had hernia surgery down in the groin, that scar tissue can make things very tight all the way up into your body. So I might need to work down in the abdomen to open that up. Next, we're going to work on a lot of strengthening and coordination and mobility. I'm not sure why I put the word stretching in there. I don't like to use the word stretching. I like to use the word mobility, where we mobilize the arm as you're learning how to stabilize the shoulder blades. So that is the primary thing that we're going to do first, is learning how to stabilize, and then we'll work on some mobility, getting more mobility in the shoulder joint itself, and then ultimately strengthening it up. Thirdly, we're going to work on a lot of postural activities to promote an optimal environment so you don't impinge. So, as we get older, a lot of people get a little more hunched over, their back is in a more rounded position, or we get people with a scoliosis. And so their scapula are sitting on their body, their trunk in a poor position, which then lends itself to impinging. So we're going to work on improving your posture and teaching you how to stabilize and stand up straight, and get you stronger so you can straighten up a little bit. Once your spine changes, we're not going to change it that dramatically. However, if you're rounded and we lengthen up in the front and we strengthen up in the back, we should be able to get you into a better, optimal, more positioning. Excuse me, I think my water guy is here. Hold on one second. Hey, sorry, I'm doing a webinar right now, so go ahead. Yeah, I need a couple new ones. Sorry about that. All right, we're just about done anyway. We talked about how please put your name and your email in the chat box, and I can send you some information. If you want to give me a call, I'd be happy to discuss any symptoms that you're having or what might be going on and make some recommendations for you. Here is my phone number, 847-541-7600. You can also email me at denise@themanualtouch.com, and I'm happy to talk to you about anything or what's going on with you. And if you have something else going on besides your shoulder, I'm happy to talk to you about that as well. Let's see if I can't copy this. I'll put this in the chat box. I'm going to stop sharing the screen, And then if you guys have any questions, you come on back on video and we can chat. Okay. Anybody have any questions?
I don't have any general questions, but I've got one specific to me. So maybe after you stop recording, we can talk for a minute.
Yeah, maybe call me.
Okay.
Or I'll call you. I think I have your number.
Okay.
John, any more questions?
No, I'm trying to get back to you. Do you hear me?
I can hear you. Yeah.
Oh, I can't get the screen back up, but where do you do the physical therapy? I mean, if we were to contact you and we were to do some physical therapy, where would you do that?
My clinic is in Wheeling at Milwaukee and Dundee. 325 North Milwaukee Avenue.
Where is that?
325 North Milwaukee Avenue in Wheeling.
Okay. Is that just an office?
Yeah, I'm in a small office building and it's just, I have one other therapist here, so it's just the two of us. So it's one-on-one with people. I see people for an hour.
Okay. And you're, as I understood it, if we have a prescription from a doctor, Medicare will pay for your services.
Correct.
And
Yeah.
Is there a limit on how many sessions can be done?
Medicare no longer has a cap on how many visits you can have for physical therapy. As long as you're making progress and we show in our notes that you need to come in, it's not a problem.
Okay. Well, thank you.
You're quite welcome. It was nice chatting with you before.
Well, fine. Well, I think I told you that I've got a couple of CT scans scheduled for next week.
Yeah, so see what the doctors have to say and then.
Right, the doctor should have, they should have an evaluation after that, and if they want physical therapy, there was a discussion of physical therapy, so it may be that I might get in contact with you and we'll talk about it.
Sounds great. Sounds great. All right.
Thank
So
you
I have
very
another
much.
therapist. What's that?
Enjoyed your session.
All right. Yeah, I have another therapist here, Kevin. So we both will take good care of you if you come in.
Thank you.
Everybody have a happy Thanksgiving.
Thank you.
Thank you.
Thanks
What's
for the
that?
talk. Speak to you soon.
All right. I'm going to stop the recording. Actually, Howard, if you want to stay on when the other two leave, we can
Okay.
chat.